Know Your Health Tuesday full recap from the last 5 episodes.
I have a chest problem, especially if I'm stressed too much, or if I'm overthinking or thinking about things that happened long ago. What could it be? So this could actually be a sign of anxiety. So you may find that your heart starts beating fast, you start sweating, chest pain, chest tightness. Those are all signs and symptoms of anxiety. So I would recommend that you see your healthcare provider, or you can speak to a family member, speak to a counselor, see a psychologist to help you deal with whatever issues are causing you the stress. Psychologists, people think, are for crazy people or people who are not coping in life. Sometimes it is good. It might not even be many sessions, but once in a while, see a psychologist. They help you with coping strategies for that particular thing or that particular phase in your life.
Is it possible to experience neuropathic pains in your feet as a side effect of peripheral nerve block after ingrown toenail surgery? So it is possible to have neuropathic pain after a nerve block anyway. Usually neuropathic pain is basically nerve pain. So you will feel pins and needles or hlabi on your arms or whichever part of the limb is affected. You might feel cramps, you might feel prolonged pain. So it is possible. Usually it would last a few days up to a few weeks, sometimes as long as 3 months. In rare occasions, it can actually be permanent. But again, like I said, it's rare. So I suggest you go back to your doctor or the anesthetist who performed it and just let them check and see if it is really neuropathic pain. But I hope you have a speedy recovery.
How can we manage fatigue? Okay. So fatigue basically is a feeling of always feeling tired, constantly feeling tired. You sleep, you're tired, you wake up, you're tired. So it's important firstly that we make sure that we're hydrated. So drink a lot of water, plenty of water. I know not everybody likes water, but tea without sugar, like rooibos tea for example, that should be fine as well. But please try and drink at least 2 liters of water a day. That is really helpful in trying to get or maintain yourself, maintain hydration. And then obviously do eat a balanced diet. So you must eat fiber and whole grains. You do need protein as well, and regular exercise. I know this sounds counterproductive, but you know, when you're tired and I'm telling you to exercise, but it actually does work. When you exercise, there's these happy hormones called endorphins that are released, and they end up assisting your body to feel much more energized. So another recommendation is sleep well, sleep early. So a lot of us like to stay up late watching series, binging Netflix. It's a good idea to get your 8 hours of sleep if you can. I know we don't all have the same body clocks. For some people, they say 8 hours is too much, 7 hours then of sleep. And try and avoid being on your phone or watching TV right up until you fall asleep, because the blue light can actually cause your brain to wake up. It sends a stimulus to say, it's time to get up now, blue light, sunlight. So it's a good idea to put down your phone at least 2 hours before you plan to sleep. And then I know we don't like to hear this, but those of you who smoke, if you can give up smoking, it's very, very helpful. It's never too late. You know, we all know the damages that smoking can cause, cancers and many other things. So I would always recommend that you give up smoking. If you'd like more information, more than welcome to come and consult at Blue Heart Medical in Centurion. And I can prescribe something that can help you quit if you're ready to quit. Also alcohol. Some people take alcohol late into the night. That can actually interrupt your sleep because you don't actually end up getting into deep sleep. It keeps people in light sleep, so it's not really good for falling asleep. Very careful with how we use antibiotics. So a lot of my patients will know I don't just prescribe antibiotics unless if they're absolutely necessary. Because if you use an antibiotic for a viral infection, it doesn't work. Antibiotics don't work for viruses. So if you do have a bacterial infection, antibiotics do work. So if you have flu, for example, a lot of patients will say, I've got flu, I need antibiotics. You don't need antibiotics for flu because flu is a virus. It doesn't work for bacteria. And what we find now is that there's a lot of antibiotic resistance. So they're not working anymore, because when you give antibiotics when they're not necessary, the bacteria that are there end up getting used to the antibiotics, and next time when you want to prescribe it, it doesn't work. So it's quite important that we only give antibiotics where necessary. If you do have recurrent UTIs, I would recommend that you come through for testing. We can test the urine. We take a sample to the lab, and they can tell us what bacteria is there and what kind of antibiotics work for it. Because there's so much resistance, there are cases that we're seeing where the usual first-line antibiotics don't actually work anymore. So it's important that we get that urine tested if it is a recurrent infection.
Can a beard cause an infection? So there are infections that can occur to men who have beards. It's important to keep your beard clean. You can get bacterial and fungal infections from having a beard. There is something called tinea barbae, or barber's itch. It is actually a fungal infection or ringworm on the skin under the beard. So it can occur on the neck, the chin, or the upper lip. So it can be caused by sharing of razors. It can be caused by touching somebody with the infection and then you touch your own face. It is important to keep your beard clean and dry. So after maybe exercising or a heavy sweat, make sure you maybe you wash your beard, make sure that it's clean and dry, because a fungus loves a warm, wet environment. And obviously under the beard, it is dark and warm and wet. So if your beard is clean and dry, it decreases the risk of this tinea barbae, or this skin fungal infection or ringworm of the skin under the beard. You can treat it with a cold compress if it is really inflamed and infected. So you just put maybe a cold cloth and press it on the lesions. You can also use over-the-counter antifungal creams. It should work within 1 or 2 weeks. If it's not cleared up within 1 or 2 weeks, please do consult. So you can come through and we can give you the oral antifungal treatments. There is also something called folliculitis, which is inflammation of the hair follicles. And you can also get razor bumps. So that's quite common in people of African descent with coarse, thick hair, or people with coarse, thick hair. So both this tinea barbae, which is the fungal infection, and the razor bumps, common in people with very coarse, thick hair. Men of African descent or people with very coarse hair, it's not recommended to have a close shave, because you do have a risk of ingrown hairs, which is what causes the razor bumps. So you can trim your beard, make it quite short, but try and avoid a close shave because it increases the risk of having razor bumps. There is treatment, obviously, that we can prescribe for razor bumps. You can come through and we'll prescribe that for you.